Well, joining us now from Herzliya for more on the pandemic is Professor Jonathan Gershoni. He's a professor of immunology and virology at the Tel Aviv University. Thanks for joining us again, Jonathan. Look, let's start with the statistic that I cited at the top of the show. You're hearing all over the media today that the rate of positive testing is now moved over 12%. More than double, I think, than it was just 2 weeks ago. Maybe help interpret it. Is this, you think, as a result of a spread of the coronavirus, or is it maybe as a result just of more testing or more targeted testing? What do you make of it?
Well, obviously, there is a mixture of all what you've just suggested. There's probably more testing. However, as you can see, the actual numbers, the percentage of people who are testing positive is gradually increasing, indicating a rise in infections. And so it's not just a matter of more tests, but unfortunately, more infections as well.
All right, so now the government again delaying its decision on, now it's become a nighttime curfew. It's supposed to go into effect in some 40 communities tomorrow. Now, originally it was supposed to be a full lockdown on a smaller number. Now we have a nighttime curfew, but we've just heard a resident, an official from B'nai Brak says, well, people can still go shopping during the day, prepare for the holidays. How effective then are nighttime curfews in a place like B'nai Brak if people are going to spend the day going in and out of shops in presumably somewhat crowded stores?
Well, obviously, this is a compromise. This is a political decision. One would have liked to see the compliance that we're now seeing in some of the communities, realizing that they have to wear masks, they have to be more obedient, more effective, which is what basically we want. I think, on the other hand, the government, and especially our prime minister, has to try to figure out how to salvage some of his political clout and comply and work with the more religious factions, if it's Litzman or Deri on the other hand. And so this is certainly not a decision which is best for trying to flatten the curve. This is a compromise in trying to maintain Bibi's position within the government and trying to follow Gamzu, Professor Gamzu, his instructions and the program that he's trying to implement. I think we need to let the man do his job.
Right. We talked even earlier months ago about concern about going into the the flu season. Now, of course, we're going through a killer heat wave now, but we are starting to come to the cusp of that flu season. How concerned should we be that, like, for example, we've seen the rate of positive testing go up as we start to move closer to the autumn?
Well, as we said previously, in the Southern Hemisphere, we actually saw that all of the steps trying to social distance and wear masks has reduced the rate of flu infections. Hopefully that will be the case also for the Northern Hemisphere. However, we have to remember that there are certainly going to be cases of flu, severe cases of flu, as we see every year. And that, compiled on the problem of COVID-19, is not a good sign.
Now, we are hearing some strain on the health system. For example, hospitals in the north, which already are kind of limited in their capacity compared to the center. How concerned should we be also going now with this rise that the Israeli health system is really going to start feel the strain?
Well, unfortunately, I'm concerned that there will be no alternative but a lockdown sooner or later, precisely because of the fact that we're seeing more and more individuals having to be hospitalized, and the health teams, doctors, nurses, and so on, are really working to their limits. They should be saluted, but that's not going to help us. We need to try to reduce the level of infection.
All right. Well, hopefully that will come. But again, more and more I'm hearing from health professionals like yourselves that a general lockdown may be an inevitability at this time, and that's going to be a tough political pill for the government to swallow. Professor Jonathan Gershoni, thank you for joining us again on The Rundown.